Hi, I'm Carol Martin. Welcome to Let's Talk Pain. On this episode, we're going to be focusing on managing pain from the patient's point of view. And we're joined today by Terry Altilio, a clinical social worker, and also by Mickey Brown. She's a pain management nurse. First, though, a bit about Let's Talk Pain. Let's Talk Pain is not only the name of our program, it's a coalition whose mission is to increase awareness of pain and improve how it's treated. Through Let's Talk Pain, we want to encourage people and their healthcare professionals to talk about pain, to listen actively to one another, and also to take action that improves care for those who have to live with pain. Managing pain is challenging under the best of circumstances. Of course, it can be overwhelming, and people with pain need allies and support within the healthcare system. And so our guests today are on the front lines of pain management, and they'll share their insight for how people living with pain can advocate for themselves and find the treatment that's right for them. And so to get to know them better, let me tell you about Mickey Brown. She's currently the Communications Director for the American Pain Foundation. She's been a registered nurse for over 32 years, and 15 of those years were spent as a pain management nurse, coordinator, educator, and advocate. Of course, she'll have a unique perspective to bring to our discussion today. We're glad you're here.
Thank you, Carol.
Also joining us is Terry Altilio. She's a social worker and coordinator of social work for the Department of Pain Medicine and Palliative Care at Beth Israel Medical Center in New York City. She's also on the advisory council of the Alliance of State Pain Initiatives and has 25 years of experience in pain and palliative care management. Terry, glad you're with us as well. This is an interesting discussion to come, I think. I want to know, first of all, from your perspectives as nurse and social worker, the question about how people with pain can really learn to advocate for themselves and for better treatment. Terry, why don't you begin?
I think the first thing that patients need to be able to do is to say out loud that they need help and to recognize on some level that there's a pain problem that for whatever the reasons is not going away. So I think that's the first step. And then they need certainly to speak with their physicians, because when you have pain, you need some good diagnosis, you need some good listening, you need people to be paying attention to try to understand what's causing the pain. There are circumstances where we never find out what causes pain, but that doesn't preclude treatment. So whether it's the patient or the family members, sometimes families notice that people are suffering in their family, and they often can be very helpful in encouraging that person to go get some help and to try to understand why the pain's not going away.
The workup then, right? The initial workup.
Yeah.
Mickey?
I think the other part that's very important is to get educated, and there are people out there that can help and resources that are available. For example, nurses and social workers are out on the front lines all the time, and we're able to help interpret very complex medical terms and jargons into areas and bite-sized pieces of information that's more understandable to the average person who is not in the field of medicine, if you will, or to family members, or help maybe bridge some of the gaps of knowledge and answer some questions and spend the time that's needed that sometimes our physicians, nurse practitioners, and physician's assistants don't necessarily have. I think that there are resources that are very valuable. I mean, personally, I work for the American Pain Foundation, and we spend a lot of our time and efforts into getting the right type of information, either through our publications or through the internet, as far as resources on different types of pain conditions, how to find help, where to find those resources, and how to better understand those resources, and then tools that you can use to help you live your life with pain in a way that serves you better and helps explain it not only to your loved ones, your employers, but also to those that are providing care for you in the medical arena.
When you say live your life with pain, that's a difficult reality to accept, is it not?
Absolutely. I think that most people think that their pain will go away, and and many of us it does. We have an incident, maybe we have a problem that requires surgery, and once the surgery heals, or the accident that we have, the damage that has been done heals, the pain goes away. But when it doesn't go away and it becomes the disease of chronic persistent pain, that's a tough one to have to live with, to realize that your life has changed dramatically and you may be faced to be living with this particular problem for years to come. And how do you adapt to that? I mean, you have to allow yourself to recognize that you can still live a life of quality if you get the right people around you and find the right type of care, so that the pain doesn't define you as a human being, but you learn to adapt your life and live with this burden of pain that you would similarly live with if you had diabetes or heart disease or something like that.
You mentioned a person with diabetes isn't identified, though, as a person with diabetes. They incorporate it in a different way, and so there's a mental shift.
There's
yes,
a mental
Terry,
shift.
that has to be done.
There's a mental shift. There's a shift that requires people to emotionally as well as mentally accept that there's something in their life that's not going away, and to decide what they're going to do with that and about that. And sometimes they do go get a diagnosis and they get care, and their pain is very well managed, and their life goes back to some semblance of what it was before. Other times that doesn't happen.
To that point, I was just going to ask that, what's the next step for a person who steps into the maze but then is not satisfied with the level of treatment care that they're receiving?
I think it's particularly challenging to answer those questions, because we hear that quite frequently. I hear that quite frequently, where people are not, they don't feel like they're getting good pain control, or they don't think they're being heard, or maybe there's other obstacles that are in their way to allow them to get the right type of care that they feel they deserve.
So what is the patient?
Well, I would say that I think it's a careful dance on finding out if who you're going to right now, say it's your family doctor, is trying but not successful, then getting the right referral or getting another opinion from someone else who might have more knowledge in that particular pain problem or in pain in general. You know, if you look at a similar model, if I was going to the physician and I had heart disease, and they managed heart disease the way that they're taught as a primary care physician, and my heart disease is not in good control, their first instinct is to send me to a cardiologist. You don't see that necessarily the same model in pain care, and I think that we need to understand that there's other resources, there's other disciplines out there that can help better understand pain when those pain problems are complex. So don't stop asking questions, and be mindful that most likely who you're going to is trying to do a good job. They just may not have the skills that is required to care for your particular pain need. So let's continue that journey and try to find the right answers by asking for referrals, talking to others in your community. For example, you may have pain nurses that are in the area, or other nurses or other social workers who know where the resources are in your community, for example, and that would be a good first step.
And there's always the American Pain Foundation.
Absolutely.
To go to on the web. Yeah. Terry, your impression as a social worker too.
Yeah, and there are enormous resources on the internet. I think that what Mickey was talking about is so very, very important, because once you've accepted that you have a pain problem, and the reality is there are specialists in pain. People don't realize that. Just like there's specialists in cardiology and oncology, there are specialists in pain. They spend their entire lives treating people who have pain and studying pain in the lab, in research, and I think that that's really important for our viewers to understand that they may have a particular pain problem that is very, very difficult to manage currently, but there is research going on all the time, and people who are so committed to this area of care. The interesting part for me as a social worker is that social work is coming late to this aspect of care. While we're very fixed and very focused on accessing and advocating and treating the underserved, we have not realized that people who live with pain are in fact underserved, and they need our help as advocates, as resource finders. And even if they don't know what I know about pain, because I've been wandering around with my expert colleagues for years and years, it's like amazing what I've gotten by assimilation. Even they don't need to be a pain expert like I'm a pain expert. They need to talk to social workers and say, I understand that you're advocates. I understand that you're really good at helping people to find resources. I need your help to find somebody who can help me to manage my pain.